And while regular trips to your GP are essential, our next guest says you can now check for symptoms at the click of a button.
Yeah, do-it-yourself health checks are now easier than ever thanks to our smartphones. Our medical expert, Dr. Zach Turner, is here to tell us the top apps we need to download. So, let's talk about diabetes. What do we download for that?
So diabetes is a thing that should be diagnosed by a doctor, but this is a great app to help you monitor your blood levels. And what it is, it's a little tiny chip, and basically someone goes at home and you can put it on the inside of your forearm, and it sits there, and it can sit there up for 2 weeks. And basically you have a little recorder, chuck it out, hold it up to there, and it'll show you what your blood glucose levels were for the past 8 hours or so. So great news for people doing it. However, have a chat to your GP because you should calibrate it, because imagine if it's giving you the wrong recordings and you're then giving yourself insulin things. So there are dire consequences if these things do go wrong, but nevertheless, great news that people are having to prick their fingers less, especially for little kids
totally.
are having the diabetics.
Exactly right. It's not the only condition that we can screen for. Now, you can check for skin cancer, can't you?
And this, I mean, shouldn't take away your yearly check, which should be mandatory in Australia where it's so prevalent, skin cancers. But this is a great way that if you see a new lump or bump or mole, you can take a little recording of it. And what it does is it looks at the colour variation in there as well as the borders. And if you have lots of colour changes and sort of inaccurate borders, incomplete borders, you're more likely for that to be a skin cancer. And it'll give you a recording or a follow-up for that. And then you can follow up 2 months later and have a look at it.
Incredible.
Good GPs will often tell you, watch out for this lump, and if it changes, we'll review it. So this is a great way to monitor that.
But before we check for skin cancer, there's a new app that helps us developing it in the first place. Stop us developing skin cancer in the first place.
Yeah, exactly right.
So what's that?
So a few different sunscreen companies who are probably very good at marketing, really. But this is a great way in which, if you know someone that is always in the sun, never put sunscreen on, and you're always worried about them, grab one of these, slap it on them, and then for the next 5 days you can record how many UV rays they're getting. And then
good
you can
for kids too.
Great for kids, and also like husbands and partners who just never put on a sunscreen. You can go, this is how much UVs you're getting. You should start covering up, and this is a great way, a great technology that'll then beam to your iPhone as well, and hopefully prevent those skin cancers.
And Dr. Zach, you have an app that acts like a real-life GP.
Siri.
So slightly better than not like Dr. Google.
No. Dr. Google. Well, I mean, I wish it was my app, but it's a great app. It's called Ada, and it's kind of like, hi Ada, how you going? Like, hi Siri. But Ada has compiled a lot of commonly asked questions that have been asked to Google and other doctors. So if you've got a symptom, if you've got something wrong with you, you can have a chat to Ada, and they'll give you some relevant questions to ask yourself, so that when you do go to your GP, you can ask and tell them the relevant questions. Likewise, I get lots of patients who come and have a chat to me, and I say, well, do you know when this happened? And they're like, oh, I can't really remember. So one of the good things about this is that you can chat to Ada, and then she'll then record all the different times you've chatted to her about anything from gastro to headaches to food intolerances and all sorts of things, and then your GP can get a readout. Yeah, so I mean that's a really good handy thing.
Before we go, Dr. Zach, at-home Pap tests, is this something that's also available now?
They are becoming more and more available. This one is great. This one's actually quite an affordable test that you can do in your own home. It shouldn't be your first test,
right? And
it shouldn't be the follow-up after you've already had or been diagnosed with something a bit nasty, so you should be following up. But certainly if you feel like you're a little bit worried, or if you're travelling, I mean, times where I've been overseas and it's just for female people that have been coming with me, hasn't been an option. This could be a great option for that as well.
Convenient. All right.
Thanks,
Thank you.
Dr. Zach. If you have any serious concerns about your health, obviously please see your